I think a patient should choose Franciscan Health Cancer Center here in Lafayette simply because we care. We truly believe in our mission. This is a ministry. It's really heartbreaking and nerve-wracking to have cancer for the patients, for their families. And healthcare is really complicated as it is. So trying to put them at ease, help them through it, always try to look for the half-full cup and hope for the best.
I would use compassion and empathy to describe how we take care of cancer patients. And right from the front office to the physicians, to the medical assistants, to the nurses, and if everybody's operating with that same underlying principle of compassion and empathy, it just makes the care spectacular.
Along with the mission, we try to provide very compassionate care. We understand that patients are going through one of the most difficult situations of their life. So just providing that extra level of support in addition to the actual cancer treatment.
At Franciscan Health Lafayette Cancer Center has a team of people that can help each patient with the unique needs that they have and the small things that you might not think of when you consider the big picture. But we have a team here that can answer virtually every concern that a patient has and help them with them.
My philosophy is we need to take care of a person as a whole, a mind-body healing. In other words, in addition to the treatments per se, we need to provide a lot more help. We want the patients to feel that they are taken care of, they have arms wrapped around them.
So genetic counselors are healthcare professionals who have specialized training in genetics and counseling. What we do is we work with patients and their relatives to translate complex genetic information into practical plans to really guide their medical management. A lot of that is through genetic testing and risk assessment to better understand what the likelihood for a hereditary or genetic cancer condition is. And then from there, we can empower patients to make informed decisions in terms of genetic testing.
Something that we always talk to our patients about and we want them to know before they come in is that we are the family that they never knew that they needed. We're here from start to finish. We are here to adjust their treatments and be there for them with whatever problem is going on. We also really focus on symptom management. No one should have to be miserable while they're going through treatment.
So nurse navigator is really crucial in patient care. They help from the time we see the patient first time for a newly diagnosed cancer. They accompany the patient through their journey, helping them with making their appointments, making sure they answer any questions they might have after the visits. So the navigator will help the patient through all of that.
I walk with my patients medically, emotionally, and spiritually every day. No matter what they're going through, they can call me, they can talk to me. Even if they're not here, they know that I am just a phone call away.
I'm very proud to say that a state-of-the-art radiation facility in the cancer center. In addition to that, absolutely brilliant breast center.
It's very stressful to have a breast cancer, and the last thing anybody needs is multiple appointments in multiple locations. And our goal is to be able to provide everything under one roof for the breast cancer patient, including every type of surgery.
The more precise our treatments can be, the higher the radiation dose we can deliver, so it also helps with control. There's a big link between advancements in technology and both cure rates and likelihood that patients will continue treatment. They're going to get state-of-the-art care in a very compassionate way.
It is very important to try to catch lung cancer early. And at Franciscan and Lafayette, we have a program for people who are at high risk for lung cancer. They qualify for a low-dose CT of the chest, and this CAT scan will help us detect early lung nodules, which may in the future develop into cancer.
We have everything a major cancer center can offer, whereas now access to something like this will mean the turnaround time for a diagnosis is even less. And as we know, for any cancer patient, every day of waiting can be very hard. So the faster we can get a result, the faster we can come up with a treatment plan, and the faster we can get the patients on the road to recovery.
Don't worry, don't be scared of cancer. It's easier said than done, but science is much more advanced now. We have a lot of tools to help people get better and hopefully get cured. I think it's rewarding to do your best to help people, and that's part of being at Franciscan. You feel like you're doing Jesus' work. So always be hopeful, and we'll work together to get you better.